Hello everyone. Thank you for joining me today. I also appreciate the DNA Technology invitation to present to you my talk titled Bridging the Gap Between Molecular HPV Testing and Routine Gynecology, where I will be sharing with you our experience with DNA Technology streamlined PCR diagnostics. I will not focus on any statistics or present detailed finding related to our HPV data, but more on how our experience highlights the need for HPV testing to be done more holistically, especially in symptomatic patients, and thus utilizing resources for better women's health outcomes. And thus, I leverage my experience with HPV testing to highlight a gap in many parts of the world between molecular diagnostics and gynecologists' practices, which we aim to bridge using DNA technology solutions. The goal of molecular diagnostics in women's health is clear, and that is to diagnose and prevent disease through early, accurate detection. However, a significant gap has persisted. On the one hand, we have the clinical world, specifically gynecologists, who need fast, affordable, and clear answers for patient management. However, any solution to fulfill these needs must pass through the accepted known guidelines. And this is where the main challenge lies, in my opinion. On the other hand, we have the power of molecular diagnostics, such as PCR, which is incredibly sensitive and specific. However, it's often viewed by gynecologists as too complex and expensive. This gap means many patients don't get the best diagnostics, and many clinics cannot leverage this technology. This is where DNA technology enters the picture. DNA technology has helped us to focus on building this bridge across that gap. This was evident to us during our marketing of our services to gynecologists. It's fascinating to see the advantages of the DNA technology solutions. In my opinion, DNA technology's general approach is built on three core principles, and that is creating tests that are comprehensive in their pathogen coverage, genuinely user-friendly for technologists to run, and critically affordable to ensure these advanced tools can be widely adopted. This isn't just a product, it's a holistic solution designed for real-world clinical and laboratory settings. This solution covers testing for HPV, sexually transmitted diseases, and the female genital tract microbiome as individual tests or as a complete panel where the holistic nature is evident. This is also clear from the latest product of FemiFluor 16.2, which I really prefer to call it FemiFluor 16 Plus or Super or even Explorer. FemiFluor 16.2 test gives an unprecedented complete solution to unravel the vaginal microbiome composition, including HPV, sexually transmitted diseases, the bacterial and yeast composition, and the identification of lactobacilli to the species level, fulfilling the description of a holistic solution for any sample, including vaginal swab and even liquid-based cytology. Nowhere is this bridge more needed than in HPV testing. We know persistent infection with high-risk HPV genotypes is the primary cause of cervical cancer. Therefore, moving beyond just positive or negative to actual genotyping is a clinical imperative. It allows us to stratify patients' risk, guide follow-up care like the need of colposcopy, and ultimately improve outcomes. The need for a holistic solution is interestingly evident, for example, when we consider the finding that persistence of HPV has recently been associated with the status of the vaginal microbiome, where dysbiotic patients may be more prone to HPV persistence than patients with a status of normocyanosis. This is a clear-cut indication of the need for a holistic solution, especially in symptomatic patients. Thus, the availability of a diagnostic test as comprehensive as FemiFluor 16.2, in my opinion, is a lifesaver for both lab routine operations and gynecologists. This would mean that from one sample and one test, the possible offending pathogens will be identified. saving resources, and achieving optimal patient management on time. When it comes to our experience of HPV testing, we have been using the HPV Quant21, which uses multiplex PCR to detect a spectrum of high and low risk genotypes in an A12 strip format. However, in our setup, the test is used on selected cases, either for screening purposes or diagnostically in patients with clinical symptoms or abnormal smears. Fortunately, most of the HPV types which we have identified so far are also detectable by the HPV screen high-risk 14, which is based on a single efficient test tube. This would be ideal for our plan to screen all LBC samples for HPV DNA. This means that we can do primary screening using the HPV HR14, which could identify 16, 18, and 45, and if the test is positive for any of the remaining HPV types, we can apply the HPV Quant21 to identify the exact type. Both kits offer a rapid turnaround time from sample extraction to results, and usually can be achieved in a single work shift, usually between 2 to 3 hours. Most importantly, the workflow is streamlined. The kits are designed with a ready-to-use master mixes and clear protocols that minimize hands-on time and reduce the potential for error, which is a game changer for busy labs. Finally, the results are presented in a very clear, clinically actionable format, directly informing the next steps for the physicians. As highlighted earlier, women's health is more than HPV testing. Female genital health is a complex ecosystem, and symptoms often overlap. DNA technology's strength lies in offering an integrated diagnostic solution. For instance, as for HPV mentioned earlier, the FemoFlor 16.2 kit provides a complete picture of the vaginal microbiome, quantifying protective lactobacilli and detecting a wide array of pathogens responsible for bacterial vaginosis, aerobic vaginitis, and candidiasis, as well as sexually transmitted diseases, HPV, and herpes. This means from a single sample, a lab can provide a clinician with a complete diagnostic dashboard, which is incredibly powerful. Ultimately, this all translates to what matters most: better patient care. In our experience, faster, more accurate results mean we can guide doctors to the proper treatment faster. Precise HPV genotyping allows for truly personalized management, and by offering a comprehensive test menu, we reduce the diagnostic odyssey for the patients who might otherwise have to return for multiple tests. All this makes our lab a more effective partner to our clinical colleagues. In conclusion, the gap between complex molecular diagnostics and routine women's healthcare is not inevitable. Our knowledge and experience in the DNA technology comprehensive solution give us the confidence to enlighten and empower more clinicians to use the data and results generated by our lab to manage their patients better. With such advances in precision diagnostics, we were able to make this a practical reality. We hope such technical advances would help to update clinical guidelines of management to fulfill this reality on a larger scale. Thank you for your time and attention.